Well, we're here with Dr. Fenderson, dentist in Napa Valley, California, the wine country. Hi, Dr. Fenderson.
Hello, Helmut.
Hi. Dr. Fenderson, let's get to the point here. Some of us people, dental patients, which makes everybody on this planet, we sometimes have 1, 2, or 3 teeth missing, usually in the back, because when we have it missing in the front, we run to a dentist rather fast, because it looks ugly. But we have 2, 3, 4 teeth missing in the back, and frankly, quite often those teeth are missing for a long time, 2, 3, 5, and more years. And it appears that nothing really bad is happening. And yet, every dentist like you keeps telling us you got to replace those teeth, otherwise all hell breaks loose. Can you shed some light on it? Why is nothing really bad happening, it looks like, and yet apparently it's so important? What's the contradictory there?
I get that question all the time, and what you're looking at is what I consider a risk factor. Rarely does someone go through their whole life with a missing tooth without some type of collapse in the bite. When there's a space in the tooth, since the teeth are constantly kind of wanting to stabilize each other, they tend to drift, lean over. They do it slowly, and that's why people don't notice it. Just like when you gain weight, sometimes it's so slowly, and all of a sudden you're puffed up and overweight. Well, what happens is the movement of the teeth and the collapse is slow. And when they do lean over, the reason dentists are telling people to replace those, because as they lean over and move, then food packs in, they get bone loss around them. So it can be a domino effect and eventually cause major problems. And I wish I could predict, because every once in a while I see someone in their 90s without much problem, and they've had the tooth lost for 10, 15, 20 years. But in most cases, it does cause damage, and that's why you'll hear dentist after dentist recommend that the tooth is replaced some way, with either implants or a bridge or even a partial.
I see. Well, so basically, the way you're explaining this, the way you're picturing this, what came to my mind is like a fence which starts slowly collapsing. You know, first it's nice and straight, you know, the white picket fence, and next thing you know, it's an ugly sight to look at it. And of course, there's no more security. The whole thing, you know, falls apart. So, you know, thieves kind of playing piano. So I got that part, but when you say, and that's I think what you mean by the bite collapses, is that what it is?
Yes, that's a really good analogy. A picket fence with a few pieces collapsing, and it can actually start affecting the front teeth because they'll move around and spaces will develop in those, even though you're missing teeth in the back.
Right, so you start looking ugly all over. Now, what's the story there? You know, that, I mean, obviously not being able to chew is one thing, but then again, I'm the type of guy who eats a steak in one bite. You know, I mean, my wife has barely done the first bite when I'm finished with the steak, and then she gets all upset because I'm getting up, walking around, because I'm finished with dinner and she barely started. So it wouldn't do any good for me to have a couple more teeth or not, but I have heard that, you know, and from an engineering viewpoint, if I look at the collapsing fence, let's look at hinges. Is it true that, like some people say, some doctors say that when you have that happening, you could possibly get headaches, you could get, you know, neck pain, neck tensions in the neck, in the shoulder. Is that a true statement, or is that a little exaggerated?
No, very true. As I see teeth, and I've been in dentistry for almost 40 years, when I see patients that do not have it replaced and have these teeth lean over and tilt and erupt, actually, if there's a tooth missing on the bottom, the top one will actually move down in the space. That starts giving bite interferences, and teeth start hitting wrong. When they hit wrong, it reflects back from where the teeth together all the way to the joint and jaws. When you have joint and jaw problems, you get little spasms in them, and they can actually come up and cause headaches. And I deal with that all the time on people where the bite is off, whether the bite is off because of crooked teeth, missing teeth, or interfering bite. It is a problem, and but unfortunately it happens so slowly. That's why dentists, again, recommend you do it before it happens, and a preventive program.
Right. So basically, it could be that there's people out there who are having headache and constant neck pain, and they keep changing pillows, they keep taking aspirin and all kinds of stuff, and try all things because they're trying to fix, the symptom, when perhaps a trip to the dentist, whether they have missing teeth or not, because apparently they can be, their bite can be out of whack or not aligned anyway. A trip to the dentist wouldn't hurt, not necessarily fix it because it might not be the problem, but at least it could be, and if not, you guys could eliminate it. Is that true?
Often I have physicians and dentists, and chiropractors refer patients to me with headaches they can't seem to solve. And we look at their bite, and sure enough, many times by giving the right type of splint and temporary devices, we can get rid of their headaches. What that tells me is that their bite is off. And people that clench, people that keep their teeth together all the time, seem to have worse problems and worse headaches. That's one of my favorite things to do, is get rid of people's headaches. And using the devices, and sometimes even rebuilding the bite and helping. And there we've talked about missing teeth, where teeth are leaned over and hitting wrong. It can be as easy as correcting little interferences, to putting splints in, to even putting new crowns and bridges in, just to get the bite fixed. But people love it when they can get rid of their morning headaches and sometimes afternoon headaches, and not have to spend hours at the chiropractor or the doctor on pain medications.
Yeah, I mean, it's quite amazing how, obviously the body is a mysterious thing, and yet it's not so mysterious if one understands it. Just like when your feet are out of alignment, you can have headaches and back pain. So, it makes a lot of sense then when things are here out of alignment, that it kind of like goes up and down a little bit and all things. So a dentist is tremendously more than just giving you a beautiful smile, which in itself, I mean, we know $1 million smile is worth $1 million. That's why it's called $1 million. It's all there is. It's beautiful, but your smile, no matter how beautiful your teeth are, don't look so good when you're running around clinching and flinching because you have a headache. We're going to get more to that, but I'm sure that that's very good news to lots of people watching here. That actually, maybe there's some hope for shoulder pains, headaches. Besides, of course, of being able to digest better and even it must be that when your teeth and your mouth is out of alignment, that you start looking crooked too, meaning ugly, basically, right?
It can be. When your teeth are out of alignment, things shift over, your midline will shift sometimes, and you just look different, and people can't figure it out. Sometimes even ugly, you're right.
Okay. Well, thanks a lot, Dr. Fenderson. We'll talk more to you. Bye-bye.
Thank you. Bye-bye.